Assalamu alaikum. Yeah, abhi to it's not even late in the afternoon. Assalamu alaikum. Kaise hain aap log? Wa alaikum salam. Okay, now we sound a little better. Session chairperson, Dr. Umar, session delegates, all of our audience members, and of course, main shuru karunga with thanking many of the people who invited me here, especially Dr. Javed Akram, Dr. Wafa Kasser, who organized everything, and of course, Dr. Afzal Mohsen. Thank you so much for the invitation to be here today. You know, when we come to these kind of conferences, the first thing one talks about is their disclosures. And I want to begin with some disclosures by me. Now, just as mujhe introduce kiya gaya, aapko pata hai, I'm a surgeon, and I happen to be dean of a medical college, but I'm a trauma surgeon. And so, of course, I'm very intimidated being present here amongst all the internists. And the reason why I'm intimidated is because I frequently find myself saying to medical students nowadays that the smartest people in the room are typically the people who go into medicine. So I want to give you a round of applause yourselves, because I know aap sab muskura rahe hain, but you knew that when you were in medical college, you were, of course, amongst the top students, and that's why you chose this field. The other thing I've noticed is that medicine in Pakistan, given the context that we work in, is actually much more difficult than you think. You see, kya hota hai ki I notice that most of the patients who come to you have very complicated problems. And many of them will come to you after going to one specialist or another specialist, and then you're the only specialist in the middle who's coordinating everybody's care. Many times those patients who are coming to you don't have access to a specialist. And so it's very, very complicated for you to manage all these patients. And that's why my respect for your organization has increased dramatically. In fact, mere khayal mein jo ye Pakistan Society of Internal Medicine hai, it's only 4 years old, but the reason why it has become so successful, mere khayal mein, abhi Dr. Sahab se ye baat ho rahi thi, I think it's become so successful because iski bahut zyada need thi. Ke you have so many complicated issues and complicated patients. For you to come together and figure out how you're going to make a difference was very important, and that's why jis kiski need hoti hai na, wo bahut jaldi banti hai. And then finally, I believe that COVID reminded us that medical doctors are true heroes. Dekhein, many patients came to hospitals all over the country. ICU doctors the, emergency doctors the, but in patients ko hospitalon mein sabse zyada admit kisne kiya? Obviously medical teams ne admit kiya na unko. In fact, at Aga Khan we ran what was called the COVID Tele ICU project. Humne kya kiya tha कि we created a room with a lot of tech equipment, and then we put a phone number out कि आपको कोई भी मसला हो मरीज को संभालने में COVID के, so you just call us. And through Zoom, through WhatsApp, we managed patients on complicated ventilators and so on. And most of the time, the people managing those patients happen to be medicine physicians. Now I wanted to start with talking a little bit about the field of medicine. Before I get into the real subject of my talk, I want to just make a note, because last week we had the International Women's Day. And on International Women's Day, we want to, of course, empower people and talk about things. Ye jo slide aapko nazar aa rahi hai, this is of the leadership of the Aga Khan University Medical College. And if you start counting that slide, you'll notice a few things. You'll notice that amongst our leadership, we actually have more women than men. You'll notice hamari jo faculty hai, usually kya hota hai ki faculty, a lot of women are in faculty, but they don't rise to leadership positions. But we're very grateful. In fact, jab main ye slide kabhi dikhata hu logon ko bahar se jab aate hain, khas taur se from the United States, from Europe and so on, when they see this slide, that more than half of the leadership of the medical college, aap dekhein, department chairs ko agar aap dekh lein, associate deans, 3 associate deans are women, department chairs of family medicine, medicine, basic sciences, oncology, OBGYN, pathology, pediatrics, radiology, psychiatry, all of these are women. And I want to just point this out to show that in Pakistan, we can do this. And we can do this better than any place in the world, because we have very talented people. One thing, thank you for clapping for that, thank you. Ek jo cheez humne ki thi, just so you know, is that we of course only want people on merit to come in. And all of these people who became department chairs, all of them went through international searches. But one rule that we made was कि जब search committee search करेगी ना लोगों को, they have to give a finalist slate that has some gender balance in it. यानी कि अगर आप कहें कि जी orthopedics का हम search कर रहे हैं and they're only men, we're not going to take it. Because women typically will not apply for jobs. Men are all very eager to go. But women usually only apply, in many instances will only apply if asked. That is why we made that rule, and because that rule was made, you can see the impact of it. And I wanted to just show that in honor of International Women's Day. Now, getting closer to the topic at hand, मैं जो आपको बताऊंगा, it's based on my experience at these hospitals. So I've had the privilege of working overseas, and for the past 4 years, I've been the dean of the Aga Khan University Medical College, and of course, I went to medical college at AKU as well. And the biggest thing that I've noted is that to set the standard of care, it is only one group. और वो हैं आप लोग. You, the faculty. This is a picture of just from last week when we had a research day and there were a lot of research faculty there. You, as the consultants, are the people who set the standard of care. और मैं आपको बताऊं किस तरह से आप लोग standard of care set करते हैं. You know, because of my role at Aga Khan, many patients call me, many family members call me, maybe many high officials call me and say, जी कि मुझे किसी को भेजना आपके पास मरीज. I send that patient, in many instances, I'll send that patient, and सामने बैठे हैं Dr. Mohammed Tariq, he's the vice dean, he's an internist, मैं इनके पास भेजता हूँ patient. When he sees these patients, and later on a medical student talks to me about how Dr. Tariq sees the patients, you understand what the standard of care is, because he will take the time to explain to the patient what's happening. He will make sure that whatever is happening with the patient is done correctly. Similarly, I see our head of our internal medicine section, Hafiz Mahmood Riaz, and many other colleagues. You see, जब आप role modeling करते हैं and show to patients and show to everybody else in the hospital what the standard should be, that's how you promulgate the standard. When you do role modeling, उसके साथ और क्या होता है कि when you train the residents, then the residents will do what you do as well. In fact, इसको एक नाम है ना, it's called hidden curriculum. जिस तरह से we act, even if we don't tell the residents to act that way, the residents will act the way they see their mentors act. So faculty set up the standard of care by role modeling, by training people, and then of course by writing down the standards and promulgating guidelines. And so today I'm going to focus most of my talk not on what we do at Aga Khan, but what I'm going to talk to you about is development of guidelines and how all of us can develop guidelines to ensure that the standard of care we provide to patients is great everywhere in Pakistan. Now, if you think about it, जो standard of care बनते हैं, इनके regulations कौन बनाता है? For medical colleges, in teaching hospitals, इसके regulation बनाता है Pakistan Medical Dental Council, previously called PMC. They put out what a resident should be doing, what a teaching hospital should look like, what a medical college should look like. For residency training, CPSP puts out exactly किस तरह से बनना चाहिए. And then at the provincial level, because of course health is a provincial subject, there are provincial healthcare commissions. And for example, in Karachi, we're under the Sindh Healthcare Commission, and Sindh Healthcare Commission came and they inspected the hospital, Aga Khan University Hospital, and said it's somewhere to go. इसके अलावा जो regulations बनाते हैं, you know, some of us will go and voluntarily seek approval. At Aga Khan, we've sought approval from Joint Commission, so it's a Joint Commission accredited hospital. I know other hospitals in Pakistan have it as well. In Lahore, Shaukat Khanum has it. In Islamabad, Shifa has it. Many hospitals go for ISO 9000. For different programs, people seek different regulations. Abhi Dr. Mohammed Umar se baat ho rahi thi about ACGMEI, the Association of Accreditation for Graduate Medical Education for Residency Programs. That's one thing. Wo bhi at AQ we've done. We've also done the ACCME for CME conferences and so on. So there are all these regulatory authorities that you can follow. But remember, the reason why I wanted to start with the point that the faculty are the people who set the standard of care is that all these people can do is provide guidelines, right? Our job is to ensure that those guidelines are made correctly and that they're up to standard. Now, वो तो regulatory bodies थी ना. Now, what we do every day in our practice is a little different. right? When we see a patient and how we manage the patient. Now, आप में से कितने लोग हैं who've used the Washington Manual of Medical Therapeutics, right? But anybody who's trained in the United States and stuff, everyone uses this manual, right? This manual says that if a patient comes in with XYZ symptoms, or if a patient comes in with this diagnosis, this is how you need to treat them. Similarly, pediatrics mein, there's a Harriet Lane handbook. The trouble is that ये जितने भी guidelines बनाए हैं लोगों ने, ये जो standards हैं, they're built for the West. And they're not built for our situation, not only our disease patterns, but our economics, what our patients can actually get done. अब इस guideline में लिखा है कि जी आप foreign CAT scan करा लें, but we cannot just get a CAT scan on everybody. We cannot get an MRI on anybody. So we have to practice medicine the way it works for us. And that's why I am very weary when we take these standards and guidelines and try to apply them to the rest of Pakistan. Now, if you don't follow guidelines, let me tell you what happens. And this is a story about a patient named Faizan. Now, Faizan, is a bank teller. आप जब बैंक में जाते हैं जो पैसे गिनता है आपके लिए ये वो बंदा है. Nice guy. अब वो बैंक में घर पे AC नहीं है उसके, बैंक में AC है. And he had this symptom. All of you are internists here. Very, very, very normal symptom, right? Frequency of urination and a lot of drinking of water. So आप medical students से पूछने वही कहेगा आपको भाई this person needs to be checked out for diabetes. But the guidelines जो current हैं उसके हिसाब से he's too young to have diabetes. So nobody ever checked him, right? उन्होंने बोला कि ये जो आपको होता है इसलिए होता है because you drink a lot of water, because it's really hot, and तुम्हें AC की आदत नहीं है घर से तो this is how it's going to be. फिर उसको he works at a bank, वो बैंक जा रहा था अपना मोटरसाइकिल पे और वो छोटी सी उसको चोट लग गई, थोड़ा सा wound हो गया पाँव में, and then what happens? It wouldn't heal. The wound wouldn't heal. अभी तक किसी ने उसका शुगर चेक नहीं किया है, ठीक है? Because we're thinking कि it's a minor thing and so on. By the time we got to him, right? By the time we got to him, he ended up with an amputation. In fact, that's why I know about the patient, because the patient became a surgical patient, right? Now, this is what happens in a minor thing if guidelines are not made correctly and are not contextual for our context. This is the outcome of that. एक तो इसमें follow भी नहीं हुआ, but basic principles we follow नहीं है ना in this case. So the question I have to all to you is, what can we do about it? Now, या तो ये हो सकता है कि all of the things we need to do, Sindh Healthcare Commission, Punjab Healthcare Commission, they come up with every patient who comes in with this problem, they need to be managed this way. But none of us want the government to doing this kind of regulation, right? What would be great is if we could develop guidelines ourselves so that we could self-regulate ourselves, right? So that we could say this should be the standard of care and all the doctors agree to it. This is why at Aga Khan, we are now creating this thing called the Center for Clinical Best Practices, CCBP. This is a new center that we're developing at Aga Khan, and here's our goal. Our goal at this center is to provide standardized, high-quality, evidence-based care using the framework that we have, which is to, whatever we do, it's based on impact. We think if we create new guidelines, we'll have great impact. We'll make sure the quality of those guidelines are very high. We'll make sure that those guidelines are very relevant. And most importantly, this is our promise to everyone, that when we make these guidelines, we're going to make them free for all of Pakistan. Anybody who wants to use them, right? And this is the concept of what AKU is trying to do, ICRA. This is our ICRA concept. And that ICRA comes from the mission that we have here. And this is the original mission of the university, and most people don't know about it. But if you read it on the bottom, it talks about how it was supposed to be, the chancellor made the university as an international institution of distinction. So pehle, ab Aga Khan 40 saal ka ho gaya, by the way. This is its 40th year. And we're going to have our 40th anniversary celebrations next week. But the idea is that we're going to make this university, and it is primarily serving the developing world and Muslim societies in innovative and enduring ways. This is why we want to build this center. Here are some of the goals, and I don't want to bore you with all the details of the center, but I will take you through development of one guideline process, right? The ultimate thing we're hoping to do is जैसे आपने देखा ना Washington Manual of Therapeutics, we are hoping to make a manual of therapeutics that would be applicable for our situation. We're very, very committed to doing this. I'm grateful to be part of the team that's working very hard to put this together. We use what's called the GRADE process of guideline creation. So aap log ne suna hoga of a group called GRADE, right? That does grading of all the different guidelines. We have partnered with the GRADE group to basically use their format to adopt. Adopt ka matlab ye hai ki, dekhen, there are all these guidelines out there, right? We don't think they can work for the Pakistani situation, but we don't want to recreate the entire guidelines. I know aap log ne Pakistan Society of Gastroenterology vagara mein, you've made new guidelines, but you had to go through a lot of detail to make it. So there's a new process called adolpment, where you take a current guideline and then you adopt it, redevelop it based on your situation. And I'll show you what we're doing for diabetes care. So pehle to ye karein ke the first thing you do is you take the most prominent guideline, right? In this case, jaise wo bichara Faizan ko jo hua tha, you take the one for diabetic care, right? By the way, it's kind of, abhi main soch raha hu baat karte hue aapse, okay, I'm talking about diabetes, meanwhile I'm a surgeon, but anyway, and you're all medicine people, so please give me a little leeway if I get something wrong, okay, please. What we do is that we take the guideline that's out there, right? This is the recommendation that's out there in the medicine world for diabetes. Okay? Isme jo recommendation hai, wo ye hai कि testing should happen after age 45. Okay, glycemic control ki testing should happen after age 45. Is this correct? Aap log practice karte hain? You do it for younger, right? But the guideline that's from this international body gives it above age 45. Now, I don't know all the details of this. I'm just telling you what's written there. Okay? So what you do is that then you take that guideline and you insert these things into what's this program called GRADE, and then you go through it. You develop the different problem statements, you know, how big a problem this is, and then you have different panels through a Delphi round that is gonna go vote through it. I'll give you a little idea. You take each different piece. You talk about the desirable effects. You look at the source guideline. You look at the evidence that is out there. You look at the undesirable effects. You look at the certainty of evidence. So this is where a lot of time is spent. Okay, what is the evidence based for this guideline? Then you look at the values of it. Then you look at the balance of effects. All these things require resources and so on. The cost effectiveness of anything that you propose, very, very important, especially for our context. How this would impact health equity. Again, these are American guidelines and they're very worried about health equity, but that's very important for us as well. Because in our situation, it's not about race, but it's certainly about socioeconomic status and what somebody can afford and what they cannot afford and what may not be able to afford. And then of course, acceptability and feasibility and so on. And then you use this computer program basically to collate all this data together, right? You collate all this data together and then you come up with any different recommendations. And so based on that, we're able to use this process to synthesize all the data and make this new guideline. So aapne dekh liya the difference between the guideline that the West made or the global North made and the guideline that using evidence we're able to do. And we think that screening should be done above 30 years of age. Would you agree with this in Pakistan? Would you, if you agree, please raise your hand, right? Thoda sa engage hona. If you disagree, raise your hand. Does anybody disagree? Okay, one or two people disagree, and you can explain to me later why. And agar aap mushkil sawal puchenge, to main fauran Dr. Tariq ko keh dunga, ye doctor saath baithe hain, inko puchunga, ye medicine ke doctor, main to surgeon. Theek? Even younger, yeah, right. I think they had a lot of debate about this, and that's what the evidence ends up coming. And this is why it's so important. This is an example of how these guidelines are all going to come out. This is what we've done up till now. We started just about 2 years ago. We created a team. Last year, we created the first guideline, which I just showed you. By last summer, we had 30 guidelines, and we just finished our 100th guideline last month. So we have a goal to finish about 160 guidelines. This will be released later this year, along with our 40th anniversary, which will be, we hope this will be a big service to Pakistan and a service to the field of medicine. We have 110 guidelines completed, about 20 are underdeveloped. Of course, this is a very big boon for our faculty because they're able to publish lots of papers from this. There we go. So the lessons that we learned were, most importantly, partner with the best institutions, build local capacity, and of course, communication is key. And I'll end with just thanking all of our people at Aga Khan. We recently had major floods in Sindh, and many people worked together and voluntarily treated about 400,000 patients from those floods. So with that, I appreciate the opportunity to be here today, and thank you so much.